This podcast has been developed and funded by Accord in collaboration with people living with prostate cancer, their loved ones, and healthcare professionals. Please note, episodes are not designed to offer medical advice, and people appearing on this podcast are talking from personal experience. Hello and welcome to the Unmentionables, a podcast that brings you unfiltered conversation about prostate cancer. The series has been created with and for people affected by prostate cancer and their loved ones. It aims to bring you open and honest discussion about some of the key challenges associated with the condition. I'm Jeff Stelling. In today's episode, we'll be talking about life on treatment and how someone with prostate cancer can look after themselves during that treatment. We'll be covering what to expect when starting treatment and providing some practical tips on lifestyle changes and managing any side effects. Starting prostate cancer treatment can affect many aspects of life, from work, relationships, and physical health. It can be a lot to process. Whether you're going through treatment yourself or supporting somebody who is, this episode is here to offer reassurance and practical guidance. Now with me today are Dave and Roger, two men who've navigated their own prostate cancer treatment journeys and found ways to live well while on treatment. They'll be sharing their experiences, the challenges they faced, and the strategies that have helped them. And joining us again is Bill, a consultant urologist who'll be providing insight into managing side effects and looking after yourself during treatment. Thanks for joining us, fellas. Now, let's start with you, Dave and Roger. Can we start by getting some of the specifics? You know, what sort of treatment did you have, Dave?
Me, I had a prostatectomy in November 2018.
And Roger?
I had a prostatectomy, which was then followed by radiotherapy 2.5 years later, because the cancer came back.
This is a very broad question, but how did you feel when you were starting treatment? Obviously apprehensive.
From a personal point of view, yes. I can't remember the last operation I had, but it was a little bit scary. But I think this podcast is covering some really good points because I had to tell the family, and there was no history of prostate cancer in my family at all.
Roger?
It came as a shock because I really didn't have any symptoms, so I wasn't expecting the diagnosis. Basically, when I went in to see the consultant after taking some biopsies done, I still couldn't believe that I had cancer.
People who are diagnosed with prostate cancer, I mean, they may well have other issues as well. Are those other issues taken into consideration when clinicians advise a certain form of treatment?
They should be, Jeff. Yes, absolutely. If a man has got other health problems such as high blood pressure, diabetes, or one of many conditions, it can have an impact on whether treatment, especially a radical prostatectomy, which requires a general anaesthetic, whether it would be appropriate to consider a general anaesthetic and surgery. Or if a man has got a bowel condition such as inflammatory bowel disease, radiotherapy may not be suitable for them. So other health conditions do need to be taken into consideration.
At that stage, were you told, by your doctor, by your consultant, what side effects you might expect from your treatment, Roger?
Yes, I was told, because the surgeon was going to do nerve-sparing surgery, but he said you could have some erectile dysfunction and you may have urinary incontinence as well.
How did you feel about that? How important were those side effects to you?
They were important, but it was more important for me to actually get rid of the cancer. I just felt I needed to, offer this surgery. I thought, well, I'll have it out. I'll have it removed.
Dave, were you told the same things?
Very, very much the same as Roger there. It was something in there that I really thought I would like to get rid of. In the same way we were told about urinary problems, we were told about sexual dysfunction or erectile dysfunction issues, which of course opens a debate one has to have with other members of the family.
And how difficult was that?
I think I dealt with it okay, because I'm still there and I'm still married. But of course, it does make a big difference to your life in the sense that erectile dysfunction always makes that difference to your life.
Yeah. How quickly did you find, having learned of the side effects, how quickly did you discuss that with, your family members?
Actually, the discussion initially with my wife was even before the operation, because we had to make a decision. It is still there on the table that you can have prostatectomy or radiotherapy. In Roger's case, it was both. But in my case, it was only the one, which was a prostatectomy. And since then, the PSA levels have been reasonable, although starting to climb now. But the conversation you have to have beforehand, because the only important person there in my sort of relationship is my wife.
Was that were there difficult discussions for you to have, Roger?
Not too difficult. I mean, my wife was with me when I got the diagnosis, and we spoke a bit about, which direction to go in, but it was pretty clear cut, really, that we go down the route of operation to remove it.
Yeah. Important, isn't it, to have the ability to talk to your wife, your family, your friends, I don't know, maybe even your employer.
Absolutely, Jeff. And it's interesting to hear that both, Roger and Dave mentioned the same thing, that their priority initially was cancer cure. And often that is, and understandably, that is the focus initially. But I'd like to ask you, obviously the side effects of treatment are potentially life-changing and unfortunately very common. When did that become a concern? Was it at the time you were making your treatment choice, or did it become an issue after you actually had your treatment?
From a personal point of view, it came about when initially told. Because I think in both instances of whether we went down the route of radiotherapy or prostatectomy, there were still going to be the same issues or the same problems. Of course, so you know about it before you go into the operation. Of course, post-operation, you then have to live with that effect. And of course, it does, over a period of time, I don't say it causes depression, but it does cause you a little bit of, how is this relationship going to last? Because I can't do the things I used to do.
Absolutely. My feeling from my clinical practices is that those side effects become so important actually after the treatment, and especially when hopefully you've been told that you've been cured of your cancer. So then the cancer cure becomes a secondary issue, doesn't it? It's living with the side effects.
Yeah, absolutely.
And I was just wondering, do you think we should be emphasizing this much more, the risk of side effects and how we manage side effects at the time you're making a treatment choice?
I think we should. Most definitely. I think the main issue that I can remember them talking to me about at the time that was going to be the most important one was urinary problems.
Yes.
Which actually, from a personal point of view, turned out to be a couple of weeks.
Right.
Post-catheter removal, a couple of weeks. Rather than concentrating at all on the potential psychological effects of ED.
Yes.
And that was something that I wouldn't say struggled with, but it started to become an issue that you, as I said before, you can't do what you think you should do as a man.
Yes.
I mean, Roger, did you find that the side effects had a psychological effect on you?
To a degree, I would say, yes. I've had urinary incontinence problems following both the radical prostatectomy and the radiotherapy. I had a double whammy, basically. So, something was going to go wrong there, so obviously with side effects. And it probably, because my operation was quite a few years ago now. It's 24 years since I had the radiotherapy, and my PSA now is as low as it possibly can be. But it was an aggressive prostate cancer to actually come back after having the surgery. And fortunately, the radiotherapy has knocked it out. But probably 5-6 years down the line, I started getting urinary incontinence. First of all, it was just a few dribbles, and I had to be careful how active I was because that brought the dribbles on. And it gradually got worse and worse. So it went from 1 pad a day to, when I effectively had to do something about it. I was on about, if I was going out for a walk at all, I was just completely incontinent, and I was on about 5 or 6 pads a day. So I decided at that stage I need to do something about it. And there's 2 options really. There's a male sling or AUS. And I rather fancied the sling because the AUS was more invasive operation. And at the time, this was back in 2016, I think it was. Yeah, so we're looking about 8 or 9 years ago, I had the operation to have a male sling. As I say, it was about 8 or 9 years ago now. And since then, I've been fully dry.
Fantastic.
I don't even wear 1 pad a day.
That's fantastic. Because obviously, I mean, Dave, you touched on it as well. The psychological issues there. You're talking about erectile dysfunction and such. Like, how did you cope with that? Did you have a support network, or was it just your family?
No, there's always a support network. We're quite lucky where we live in the sense that there's a local support group which I'm a member of and help run, and so we can actually talk to ourselves, or talk between ourselves, I should say, within the group. There are quite a few options that you can actually do, and that takes time to go through. And actually, that helps because at least you think to yourself you're making an effort to try. So, there are creams, there are injections, there are tablets, there are in fact multiple types of tablets, all of which can have an effect. But like Roger, I had nerve-sparing surgery, which in effect should have left some nerves, but unfortunately doesn't necessarily do what it says on the tin. And so consequently, nothing's particularly worked well with me at all.
What sort of practical steps then, Bill, would you recommend to someone like Dave?
In terms of, that's really a good question. In terms of, I think it's really important that clinical teams have the conversations with their patients before the procedures, especially before surgery, about the risks and also the things they can implement before the operation, such as pelvic floor exercises. And also have the conversation that if they are one of the few unfortunate men who do experience significant urinary incontinence, but there are treatment options available on what they involve and the implications of having it. It may mean a second operation to insert, as Roger says, an artificial urinary sphincter. So these are very important conversations to have before you make that final decision. But there is much more emphasis now on not waiting until a complication arises and then treating it, but obviously trying to minimize that risk and doing whatever the patient can do to try and rehabilitate themselves or put themselves in an optimal position so that they minimize that risk. So I don't know if you was told before your operation to do pelvic floor exercises.
Very much so, yes. In fact, I'm actually quite a fit person.
Yes.
And I think I was diagnosed in July 2018. And between the period of July and November, I was pelvic floor exercises all the time.
What impact did they have, Dave? Because, I'm a complete layman. People talk about pelvic floor exercise. What real impact do they have?
None. In the sense of, sorry, if you mean in doing them, you don't have to take a break or go to a gym or anything like that. You can do them as you're walking, as you're standing, as you're talking, as you're sitting on the toilet. Right. It's you can exercise them all the time. It's very, very important, especially for making sure that once that catheter is removed, you can start to gain as much muscle power back in that one sphincter, is it, that you have left, to actually start to get that control back. Sometimes it's good, sometimes it's not. Obviously, in Roger's case, he had to have another series of radiotherapy for it.
Yes. Can I ask you, was you put in touch with a specialist to teach you how to do pelvic floor exercises, or was you just advised to do them and you basically sought your own?
I was advised to do them, and oddly enough, one of the CNSs at the hospital actually said, go and look on YouTube.
Yes.
And there's a Australian chap on YouTube that sort of is doing it all the time, telling you. And there's some really good videos, really good podcasts on how to actually do them.
Yes, there are some great resources on the internet, but it's a shame that a lot of departments don't have that resource locally.
That's very true.
Yes,
that's very true.
And was you put in touch with anybody to discuss management of erection problems, or?
Not at the time, but there's since actually appointed. This is the local hospital, of course.
Yes.
Since actually appointed somebody into, I think the word is andrology.
Yes.
And I've spoken to her a few times, and she's actually tried me with a few different gels and things like that.
And that's been beneficial.
I don't know. I mean, as we're talking nice and plainly here, the gel was an awful problem because you felt you were walking around with an erection all day,
Right.
which was not a nice feeling.
No.
Although you weren't.
No.
Next question.
No, it's interesting talking about side effects, isn't it? Because, that people feel they're not discussed enough. No. I know from talking to you already, Bill, you feel that they're not discussed enough. And I wonder whether that's almost an exclusively male thing. Is this down to embarrassment? Is it down to, not wanting to bother your doctor again? I mean, why do people feel this way?
I think men, I'm speaking on behalf of men, but I think men do feel a bit inhibited about speaking about these things because, as I said before, the priority is the cancer treatment, isn't it?
It is.
The focus is the actual treatment, as you say, getting rid of that cancer. And most men feel that they'll deal with whatever comes of it, what are the side effects. But it's crucial that the conversation's had right from the outset.
Very much so.
That these are the potential risks, and those risks are life-changing. What can you do to help yourself and to minimize those risks?
Roger, did you have somebody to go to, somebody you could talk to about side effects?
Well, essentially, my wife was the first person to talk to. I joined a support group, a prostate cancer support group, and I found that valuable. Actually, meeting with other men that had been through similar circumstances to me, and everybody had a story to tell. And we used to meet. Probably initially, the first group I got involved with was fairly small. There was only about half a dozen people there, half a dozen men, and we used to just share our experience around the table. I found that helpful.
Is that in some respects? Can that almost be easier than discussing it with someone like your wife?
Yeah. I found it easy to discuss it with my wife. I didn't have a problem. Maybe some men do, but we just got on with it. It was like you say in the leaflet. If you don't want to have the treatment and you don't want to do this, then you're on the way to dying. Basically, I wouldn't be here today if I didn't have the treatment.
Do you think we, as clinical teams, do enough for patients' partners?
No. But then, what can you do?
That was going to be my next question, Dave. We try our best, obviously, to support patients, but there is a need, isn't there, to support their partners?
I think there is a need, and it would be a very good concept for you to actually insist that partners attended before a final decision was made. Unfortunately, I was on my own because I didn't think I could have any sort of cancer. So when I went into the hospital after the biopsy and all of these things, and the doctor, or the urologist in this case, said that I'd got cancer, I was on my own. So,
and I presume you would have preferred to actually been with your wife.
I certainly would have done.
Yes.
But if that person knew, the urologist knew that that's what he was going to say,
yes,
then I would have thought that some interface to say, come along with your wife, or not on your own, or something like that, would have actually been very helpful.
Absolutely, yes.
I mean, you deal, obviously, Bill, with people from all walks of life. Do you still find that people are reluctant to talk to their medical team about side effects, whether it be erectile dysfunction or whatever? Absolutely, yes. People have slightly different opinions and approaches to this. And that's why we have a very extended team, and we as clinicians often deliver the diagnosis, but we're heavily supported by the clinical nurse specialist, who I'm sure you've had a lot of contact with, who are very skilled at counselling men on their diagnosis and their side effects. And I find that men are more willing to open up to the clinical nurse specialist
especially if that's somebody who follows them through their diagnostic and treatment journey, so they are familiar with the person.
Absolutely. To have one set of nurses throughout the entire pathway is actually really, really useful. I'm sure you find that as well.
At the time I had my operation, there was very little support around, very little. Now things have changed considerably with the robot coming in and specialist nurses to look after you, having a phone contact line to get hold of them. None of that was there when, because I had open surgery at the time. So,
I mean, I also lost myself in helping, doing awareness courses for Prostate Cancer UK and for other people, sometimes at football clubs. And that actually helps because you feel as though you're putting something back.
I mean, there's no doubt the awareness of prostate cancer has changed immeasurably over the years. When I got involved with Prostate Cancer UK, I used to think it was called prostrate cancer. I had no clue. I think most other people, or many other people, felt that way as well. But I was just wondering, after all you guys have been through, you know, I mean, Roger, 24 years ago, you know, given this diagnosis of prostate cancer and you know, the ordeal of it coming back again, and the side effects and so on and so forth. How would you assess how things have turned out in comparison to perhaps what you anticipated?
difficult question, that really. I mean, I didn't anticipate anything beyond, you know, getting removal of the cancer.
Right.
Beyond that, I didn't have any other thoughts really. I just wanted to get the cancer out of the body, and then get on with life. I was in a very stressful job at the time, and after I had the radiotherapy, I got out of that job. I changed my diet completely. Become almost vegetarian, although I do eat fish. So I cut meat out altogether. And tried to adopt the Mediterranean diet as much as possible.
Yeah. Simply thinking for anybody out there who might be facing, you know, an operation at the moment, for instance, Dave, would you say that having been through your operation and suffered the side effects, you know, have things turned out acceptably for you?
Yes, they have, acceptably. I knew what the circumstances were with regard to the side effects, and so really it was my decision to get the cancer taken out and take the side effects with it. So yeah, unlike Roger, I've not really changed an awful lot. Still eat the same, still drink the same within reason, still do the same exercise.
Yes. Is lifestyle change important, Bill, do you think?
It is with most conditions, yes, and including prostate cancer, you know, dietary advice on exercise, and just general well-being, you know, the importance of sleep and relaxation.
Hang your head in shame, Dave.
Is it really important? And probably more so for men who are unfortunately diagnosed with advanced prostate cancer, who require some of the more advanced medical therapies which have side effects. In order to minimize those side effects or to make them more tolerable, diet, exercise and general well-being are really crucial. Unfortunately, it is one of those things which doesn't get discussed often in clinic, especially at the outset. So, yeah, it is important, Jeff. Yes.
For anyone who might be seeing their doctors now and facing an operation, Dave, have you got any advice about what sort of questions they should be asking their doctor or clinical team? About side effects, I mean, principally.
With regard to side effects, they should be definitely asking their doctor about them, about the use of the catheter, how long that would be in, what happens when it's removed, how long do I rest for. The side effects, particularly the biggest one, which of course we talked about a lot, ED, what the effects of that is. The other things that you can do to mitigate that in terms of tablets, in terms of gels, in terms of injections, in terms of pumps. Those questions ought to be asked, I think, and answered before they go into an operation, so that the people are really aware of it.
Yeah. Roger, you agree?
Yeah, I would fully agree with that. But add to that, sort of ask the question of what's the percentage chances of coming down with erectile dysfunction or urinary incontinence. So you've got
Were
idea.
you told that? Were you given any idea?
No, I wasn't. No.
Is that more commonplace now? Would people be given an idea of the percentage chances?
They should be, Jeff. And the importance is that there are some fantastic tools, statistical tools, which are available based on the treatment results of many thousands of men in the UK. So we can give men percentages. But what's more important is actually giving that man is personalised risk, because a percentage point, percentage risk is meaningful. But you want to know is what's the chance of you personally experiencing that problem.
Yeah.
And that's the information you need to be asking from your clinical team. And if you do experience that problem, what can they offer you locally? And what impact could that have on your personal lifestyle?
Agree with you. One other question, though, one should ask the doctor, is if you've not made a decision, ask what treatments are available. Because as time is moving on,
Yes.
more and more treatments are actually becoming available.
And that's a really important point, because you should ask your clinical team, what is the impact, or if I didn't have treatment? And we know that for a lot of men with low risk prostate cancer, active surveillance or monitoring is a very good option. Most men do not need treatment because their prostate cancer is never going to cause them symptoms, and neither is it going to reduce their life expectancy. So for a lot of men, they don't need treatment. And for some men, they can defer, they can delay treatment, because as you say, Dave, treatments hopefully and do continue to get better as time goes by, as we as clinicians do more research. So for a lot of men, they don't need treatment, or they can defer it to a later stage.
Very much so.
And that's important to ask the clinical team whether that is an option.
It begs the question, to be honest, Bill, doesn't it? Why should anybody who has prostate cancer have to ask these questions? Surely their clinical team should be volunteering all of that information to everybody.
Yeah, and most teams do, Jeff, but it is a challenge in terms of, as you've probably experienced, guys, is that the consultation time with your clinical team is limited.
Yes.
And understandably, the priority is about cure, and the treatment options are available, and the direct implications of their treatment. Though these additional things which we've discussed today, like well-being, sleep, fatigue, the impact on work, is often deemed as a secondary issue, but it's not. But as clinical teams, we need to find the time and the space to discuss these important points with patients.
Totally agree with that.
Yes.
Totally agree with that.
Of course, what's been made clear again here is that however clear the side effects were made to you, you'd made the same decision, wouldn't you? From your perspective,
Of course.
you vote for life.
We vote for life. That's
exactly.
it.
Yeah.
I mean, it's life sustainability is the important aspect of it, and that's what we think about.
Look, Roger, Dave, thank you so much for coming and sharing your stories today. Bill, thanks once again for your expert input today. If you want any more information about the topics we've covered in this particular episode, you can go to Infopool or Prostate Cancer UK. Accord has been working with a group of patients, caregivers and healthcare professionals to develop a prostate cancer discussion guide. If you want to talk about any of the topics covered in this episode with your healthcare team, the personalised guide can help you think about the questions that you want to ask. You can then download and print those questions off and take those to your appointments to have a more informed conversation. You can find details in the description of the podcast, wherever you're listening and watching. Join us next time as we'll explore how a prostate cancer diagnosis can impact how someone might communicate with their loved ones and how others might talk to the person living with cancer. We'll be discussing common challenges and providing some practical tips to support good communication and productive conversations. Join us then.